welcome to LexTalk.World talk show presented by Clickaway Creators. Today we have Ms. Kimberly Halva with us. She is the Senior Associate General Counsel at Fairview Health Service. Kim received her law degree from William Mitchell College of Law and her MPH from the University of Minnesota. For the past 25 years, she has worked as both a senior attorney and compliance officer for large insurance carriers and healthcare providers in the Minneapolis-St. Paul area. She currently serves as corporate secretary and senior counsel to Fairview Pharmacy Services, advising the organization on a wide variety of issues that arise from the day-to-day operations of Fairview's pharmacies, labs, hospitals, and clinics. Thank you so much for joining us, Kim. We are pleased to have you with us today.
Good morning. Thank you so much for having me. First, let me say how grateful I am for this opportunity to be able to share my experience on such a great platform for legal professionals.
We are absolutely pleased to have you with us, and I'm sure that the experiences that you're going to share with us will be really helpful for a lot of industry peers, for a lot of young lawyers, as well as law students. So to start with, Kim, I would request if you can please give us a quick background of your journey so far on the personal and professional space both.
Sure. Well, I am an attorney who's lived and worked in the Minneapolis area, as you said, for the past 25 years. I have my JD from William Mitchell and my master's degree in public health administration from the University of Minnesota. I'm currently a senior counsel at mHealth Fairview, and we have a couple different corporate names. And as you said, corporate secretary and legal counsel for mHealth Fairview subsidiary called Fairview Pharmacy Services. Basically, on a day-to-day basis, I advise on the operations of our retail, inpatient, specialty, compounding pharmacies. I also oversee the legal services for Fairview's transportation, imaging, long-term care, and laboratory services. So since COVID, things have sort of shifted a little bit, and I spent a great deal of time sort of what I would do calling quick contracting for COVID-related supplies and equipment, such as ventilators and swabs, testing equipment, isopropyl alcohol and hydrogen peroxide to make hand sanitizers and things like that. I'm also currently working on a project with this University of Minnesota, the Mayo Clinic, and the state of Minnesota, operationalizing laboratory services for COVID testing across the state of Minnesota. Sort of even more recently, last 3 weeks, the murder of George Floyd occurred about 3 miles away from Fairview's main campus. And the resulting civil unrest damaged quite a few of our facilities. And so over the past 3 weeks, I've been helping to secure our drug supply, assess any HIPAA violations, physical plant damage, all those type of things that are related with the destruction of some facilities. And then kind of more importantly than that, working with everyone at Fairview to basically ensure that we can continue to provide services, the services that people need, even in a time of civil unrest. And that's sort of where I am right now.
Oh, fantastic. And I think you talked about COVID. Yes.
Yes.
Life has been different. And I think a lot of things have changed around us. And you talked about George Floyd. So I think that's also a key topic these days that everybody's talking about. And you are so close and working on that in your personal capacity too. So thank you so much on that. Taking this forward from here, and I would like to talk about COVID-19 a little bit more because everybody wants to know about this. So I think we want to know how the healthcare sector in the United States has impacted because of COVID-19, because I think you guys are in some additional pressure now. Everybody's looking up to companies like you to help, families, companies, individuals, and everyone. So what sort of impact do you see on the healthcare sector in the United States due to COVID-19? And what solutions do you foresee in a legal perspective?
Okay, great. I think the most obvious impact COVID-19 has had on the U.S. healthcare sector is the wildly expanded use of telemedicine services. So the technology for telemedicine services has really been there for quite a while, but the regulations relating to and the reimbursement for telemedicine services really, the reimbursement structure for telemedicine services really has not kept pace with the technology. Significant legal input is and really will continue to be needed to create the regulatory and payment structure for telemedicine so that it can continue to meet the demand identified by COVID-19. So most importantly, legal professionals will need to help assist lobbying the AMA and CMS to establish appropriate payment codes for the various types of telemedicine services. There's lots of issues around clarifying state licensure requirements for professionals who may be performing services via telemedicine out of state. Payer and provider agreements are going to need to be amended or revised to set forth the requirements for payment for any type of telemedicine services. And then I think sort of for those people working in the compliance sector, those legal professionals working in the compliance sector, there's really a need to develop a mechanism for the prevention, detection, and correction of the misuse of telemedicine services. So in addition to telemedicine, COVID-19 has really shown an additional need for the home delivery of certain types of products, such as durable medical equipment and prescription drugs. And so given this growing need or this newly identified need, I really think new non-healthcare organizations that have existing distribution channels are really going to invest more capital into capturing this market segment. Although similar, the distribution of highly regulated products like durable medical equipment and prescription drugs, it's really more complex than the distribution of more traditional products. So a shift from a healthcare delivery model to a home distribution model will really require legal professionals to bridge that gap. So for example, non-healthcare entities entering the market will need to try to adapt their existing procedures to allow for consent and notice of privacy practices requirements. I think legal professionals will also be needed to advise on the accuracy of billing of insurance providers and government programs, particularly for entities that are really more familiar with direct consumer transactions. And then I think finally, and probably the biggest for me, is beyond the telemedicine and increased need for home delivery of products. COVID really has exposed one of the greatest vulnerabilities of the US healthcare system, specifically that the US healthcare system doesn't really financially support preparedness for widespread public health emergencies such as COVID. The system we currently have really operates on the margins. We try to provide the best possible care at the lowest possible cost. And there's really no reimbursement or compensation for private healthcare companies to prepare for more remote possibilities such as a pandemic or a national emergency. So I think this is where legal professionals, in addition to medical professionals, public health professionals, financial, everybody sort of needs to come together to work in collaboration, really, to develop a financing model for public health preparedness. I think legal professionals are really uniquely qualified in this area to help identify what state and legislative changes really need to be done to create this type of program, and so that we can be better prepared as a community going forward.
Yeah, that's right. I think everybody is impacted during this time. It makes a lot of sense when you talked about collaboration, because that's where everybody will have to come together and work on a common solution that can really help mankind come off this issue as early as possible. And rightly talked about telemedicine. I think now this is the time when we understand the importance of telemedicine more than ever, if I'm not wrong. And to take this forward, I think I have one more question on COVID-19.
Sure.
I want to know about, what sort of general impacts will COVID-19 have on the confidentiality of patient information?
Sure. So one of the things with COVID-19, or it's been identified by COVID-19, is contact tracing. So there's sort of a new increased need, exponential increased need for testing. And right now, the privacy laws that are in existence really focus on allowing this the disclosure of a person's health status to public health officials for public health emergencies. But what we're starting to see is private employers such as meat packers, meat packing plants, poultry processing, needing to understand the health status, or at least the COVID status of their workers, to both prevent infection and spread throughout their facilities, but also to protect the food supply. So this sort of wild expansion of the need to track individuals, both on a government level and on an individual employer level, is really going to have a big impact. I think it's going to significantly erode individual privacy rights. But I think here's where legal professionals really can come in and help to find the right balance between public safety and the need for individuals to have their privacy rights respected. So it's really an evolving space, but there'll definitely be some changes. What those changes will be, I think, is really going to be dependent on legal professionals to get in there and really argue and find the correct balance, because both interests are very important.
Absolutely right. And this is for the first time we are seeing something like that. And if we are able to create right solutions this time, if it happens ever again, we'll be in a better situation to deal with this. So I think it makes a lot of sense from that angle. And obviously, the confidentiality of the information is very much important. All right, moving ahead. And this takes me to one more question on COVID-19. And I want to know, what do legal professionals need to know about the differences in addressing a public health emergency such as COVID-19 and an emergency resulting from civil unrest?
Sure. So I've recently had the somewhat unfortunate experience of trying to simultaneously lawyer my organization through both COVID-19 and then significant civil unrest. And reflecting back, and I don't know that it's over, but in reflection of what's happened so far, I think one thing that I can truly say is that no two emergencies are the same. Everything takes a different response. It takes different actions. It takes different things, different things that you need to do in response or in preparedness for an emergency. That being said, I think legal professionals by training have trained reasoning skills and organizational skills and leadership skills. And those skills are really needed for organizations to move forward and sort of navigate the waters in these situations where, nothing is sure. There's no playbook for what you're supposed to do, but you do and you can rely on your reasoning skills, your organizational skills, and just your common sense. And I think that's been the biggest takeaway for me, is that sometimes you don't know what you're doing, but you have the skills to be able to you've had the skills, you've had the training to be able to navigate through, and this too will pass.
Yeah, that makes a lot of sense, I think. Now, the next question, I think, will be more focusing on young legal professionals. And since you have been in the industry for quite some time, we would like to know your 3 core values that you truly believe in. And you think that if our young legal professionals also inculcate those values in their profession, they should also be able to, create a flourished career out of the legal space.
Sure. So I'd say the 3 core values I use or implement the most or believe in the most are integrity, empathy, and persistence. Really, for me, integrity is the most important. For me, it means having the flexibility to work with others and create solutions, but also having sort of the strength of character to speak up when your advice is unpopular. I am often asked to assess the legal risks associated with different projects and different programs, and it's not always popular advice when it comes back. And so there's this need to have the integrity to say, this is my legal advice, this is my professional advice, this is what I bring to the table. That being said, you still being flexible, but having the integrity to stand by what you say and to basically just stand by what you say and the advice that you give to your organization. I also work a lot with contracts, and for me, empathy is really important when trying to, in contracts in particular, where you're trying to reach sort of a mutual agreement between the parties and sort of set the stage for a good relationship going forward. If you can't appreciate really the other side's needs and wants, and if you truly can't appreciate through empathy your own client's needs and wants, you're going to have a really hard time coming to mutual agreement and resolution and basically completing the contract. So I think good legal professionals regularly use empathy to inform their advice and help to set the stage for meaningful understanding between various individuals and organizations. The last I would say is persistence. So I think persistence is just essential for effective legal work. It can take years, literally years, for a situation to resolve itself, or for a situation to come full circle, or for you to be able to close out a case file. And I think good legal professionals need to really be willing to go back time and time again, reassess, reevaluate, reanalyze, particularly when circumstances change your advice may change because the circumstances have changed. But be persistent, keep working at it, keep going back, because these things aren't stagnant and they tend to last a long time.
Absolutely, you're absolutely right. These things are stagnant, and perfection won't come overnight. So it'll definitely want you to keep going back and keep trying, unless you really understand different situations and are able to and have the experience of dealing with those situations. Thank you so much, Kim, for sharing so much of information about the healthcare industry, COVID-19, how a lot of legal professionals can really deal with these current issues right now. So I think it makes a lot of sense, and it'll be very helpful for a lot of our viewers watching this video. So I would like to thank you for sharing such great insights with us. For our viewers, if you like this interview, please like and share this video. Also subscribe to our YouTube channel, ClickAway Creators, to have more coming from these industry leaders, and keep appreciating us. Thank you so much for joining us today. Have a great one ahead.